What are syncope and presyncope in chronic fatigue syndrome? Syncope and presyncope are important symptoms to understand for those dealing with chronic fatigue syndrome. These terms relate to fainting and near-fainting experiences that many people with this condition face. Syncope is when someone actually faints, leading to a temporary loss of consciousness. This happens due to a short-term drop in blood flow to the brain. On the other hand, presyncope is the feeling of almost fainting without actually losing consciousness. Those who experience presyncope often feel lightheaded, dizzy, nauseous, sweaty, or weak. In the context of chronic fatigue syndrome, these symptoms are frequently linked to a problem with the autonomic nervous system. This system controls automatic functions in our body, like heart rate and blood pressure. When the autonomic nervous system does not function properly, it can cause a significant drop in blood pressure or insufficient blood flow to the brain, especially when moving from lying down to standing up. This condition is known as orthostatic intolerance, and it can lead to both presyncope and syncope. Research suggests that up to 90% of adults with chronic fatigue syndrome may experience symptoms related to orthostatic intolerance, including syncope or presyncope. These symptoms can greatly affect a person's quality of life. Fatigue, a primary symptom of chronic fatigue syndrome, is closely tied to syncope and presyncope. When there is reduced blood flow to the brain during these episodes, it can worsen feelings of physical and mental exhaustion. Additionally, individuals with chronic fatigue syndrome who experience syncope may also report other symptoms related to autonomic dysfunction, such as weakness, nausea, and difficulty with exercise. To diagnose the reasons behind syncope or presyncope in someone with chronic fatigue syndrome, healthcare professionals often measure blood pressure and heart rate changes when a person moves from lying down to standing. They may also use specialized tests, like a tilt table test, to evaluate how well the autonomic nervous system is functioning. Because syncope and presyncope can be severe and disabling, it is crucial to have a thorough evaluation by healthcare professionals. This helps rule out other potential causes and manage symptoms effectively. In summary, syncope and presyncope in chronic fatigue syndrome are signs of autonomic nervous system dysfunction that can lead to inadequate blood flow to the brain when standing. This results in fainting or near-fainting episodes, which add to the overall symptom burden of chronic fatigue syndrome. Understanding these symptoms can help individuals seek appropriate care and improve their quality of life.